Hi everyone, my name is Stefan, I'm a pulmonologist. In this video, I will continue the series on how to use inhalers. So this will be a review of the Symbicort Turbuhaler device, which is commonly used. Many patients have seen this white top, red bottom inhaler before. I'm just going to run through what the inhaler does, how it works, and I'll demonstrate on myself how to take it. So hopefully that will be helpful for you. So Symbicort is a very, very common inhaler. It's used by many, many patients with respiratory disease, with asthma, with COPD. Now, this inhaler is a combination inhaler. It is used as a controller more than a reliever, although it can be used as a reliever as well in some therapeutic regimens, but generally it's used regularly twice a day, or as your doctor directs it, maybe once a day if your asthma is very well controlled, for example. But generally follow the instructions your doctor gave you. Now, this inhaler contains two medications inside. So it contains a corticosteroid, which is basically an anti-inflammatory drug that controls the airway inflammation. And then there is also a bronchodilator, a long-acting bronchodilator that lasts for about 12 hours. So that opens up the airways and keeps them open for about 12 hours. So that's why generally it's used twice a day. One thing that I would mention from the beginning, after you've taken this inhaler, because it contains a corticosteroid, it's a good idea to don't forget to take some water in a glass, swish it around your mouth, gargle and spit. This is to prevent any sort of residue left at the back of your throat, because that can sometimes irritate your vocal cords, cause a little bit of oral thrush or your voice going hoarse. So this is one thing to remember, and maybe sometimes that's not mentioned, but that's quite important. But now let's get into how the inhaler looks like and how you use it, basically. So Symbicort Turbuhaler, the Turbuhaler device, basically, it looks like this. This is a demonstrator device. It doesn't have any medication inside, but I'm just going to use it on myself just to show you how it works. So it has this white top and this red bottom wheel looking thing. So if you want to open it up, it's quite easy. You just hold the red part and you twist off the top. Right? So it just twists off. It has like a screw thing inside. Right. Now, if you look at it, then it has a mouthpiece at the top, and then it has a dose counter here. Now, you may notice that on this one, for example, it shows as, I'm not sure if you can read this actually, but it says 60 and 80. So basically, this inhaler won't show you each dose. It won't go like 61, 62, 63, etc. So it will show you a rough estimate of how many doses are left in the inhaler. But don't worry, it's working. If you're using it correctly, it won't be a problem. So even if you've opened up a brand new inhaler, you've taken a puff or two, and you see that this dose counter doesn't go down, don't worry about it. It will. It just takes a bit of time. You need to go through about 20 doses before you'll see a change. But this was a common question I got asked. Now, so like I said, mouthpiece, dose counter, these are essential. There are some little holes on the side. Try not to cover those when you're using the inhaler, because that's where the air goes in and picks up the powder inside and then delivers it to your airways. So this is a dry powder inhaler. So the inhaler technique, which I will demonstrate shortly, is forcefully and deeply breathing in, right? When the inhaler is armed. So this is quite different compared to a blue inhaler where you need to be slow and deep with your breathing. This one, you need to be quite quick to get that powder moving from the inhaler. But I will get there in a sec. Once you've opened this inhaler, if you hold it in your hand, you still need to arm it before you use it. So it's a sort of a two-step technique. You open the top up, so you open it up, and then you need to arm it. How do you do this? Holding on to the white part and holding on to the red part, you just twist this, right, like this, and twist back. So this is basically a clockwise, counterclockwise movement. And when I twist it back, I think you may have heard that there was a little click there. That just means that it's armed, it's ready to go. So you really just twist once and twist back until you hear the click. And that means that it's inhaled, it's ready to use. So how do you take this? As I said, you need to breathe in forcefully and deeply. But first, you need to empty your lungs. So really no air in your lungs. And then you'll have plenty of space to breathe this in and really deliver it deep within the lungs. So I'll demonstrate this now. So breathing out first. and slowly release. So ideally, after you're done with this forceful inhalation, try to hold your breath for at least 10 seconds if you can, or as long as you're comfortable. Aim for 10 seconds, but if you can't do it, that's fine as well. Now, once you've done that, basically you've taken the dose. So there's nothing else you can do, just screw the top back on. However, if you need to take another dose, it's very easy. You don't put the cap back on, but you need to arm it again. So again, we do the same sort of clockwise, counterclockwise motion until it goes click. So let's hear this now. Pop, pop. And it did this click. You've heard the click. Now that means that it's ready to go. So you breathe out and then forcefully breathe in, hold your breath, release. Let's do this now. And slowly release, right? So try to hold your breath longer than I have. For the sake of this video, I won't have you waiting for me for 10 seconds while I'm holding my breath. Right, so basically I've done that, so that means that another dose has been delivered. What if I want to take another dose? Again, I twist, clockwise, counterclockwise. Click, ready to go. So I do it again, same maneuver, breathe out first. Slowly release. One thing that I'd like to point out about this inhaler, so older generations of Symbicort, the powder had a bit of a taste. Now, apparently the new ones, they don't really taste of anything. So even this demonstrator device, as I'm taking it, although it has plenty of doses left in it, I don't feel anything, the powder is tasteless, but I can feel there's a little bit of a scratchy thing on the back of my throat. So that's just to let you know, to reassure you that the medication is being delivered. So it will come through, but it's just that the powder may not taste of anything, depending on where you buy the inhaler from. So that's something of note, because many people are worried that they haven't really taken the dose, but it's coming in, don't worry. Like I mentioned at the beginning of the video, please don't forget to just take a little bit of water, swish it around, gargle, and spit at the end, because you don't want that powder really irritating the back of your throat. This is quite important. What are some of the pros and cons of this inhaler? Now, so let's start with the cons. Basically, it has a two-step technique. So this may not be such an issue, but you have to twist this off, then you need to turn clockwise, counterclockwise, and then it takes a little bit of fiddling at the beginning. The other thing is that you need to breathe in forcefully and deeply. So that's sometimes a little bit difficult for people who are struggling with their breathlessness, or they're really, really exhausted, for example, or they're in a really bad shape. It may be difficult for them to achieve enough power to mobilize the powder effectively, especially if they cannot really synchronize their breathing to really empty their lungs fully and then powerfully breathe in. So that can be sometimes a bit of an issue. It's something that if you're struggling with, please discuss with your doctor to see if an alternate inhaler can be used for you. Now about the pros, obviously some people like this design. So some people like the shape of the inhaler, that it can be stored anywhere. You can put it in your coat, you can put it in your bag. It's easy, it's small. It doesn't really open up on its own. It's something that you need to twist off like a cap, and then basically you just do this, and then it's ready, and then hard breath in, hold your breath, and it's done. So some people like that. So I think for that reason it's okay. And another thing would be that Symbicort can also be used as a reliever medication as well in some therapeutic regimens. So this is something you need to discuss with your doctor depending on your situation. Not for everyone, but that's one of the pros in my opinion as a doctor. But this is basically a very common inhaler. So if you come across this one, this is how you use it, what it looks like. So hopefully this video was helpful to you. I'm not endorsing the use of Symbicort over another inhaler. So I'm just saying that basically this is what the inhaler looks like. And please make an informed decision with your doctor. There are many inhalers on the market. Thank you very much for watching. I'll see you in the next videos. All the best.